Here we have a dissected sheep heart. First, I will discuss some structures on the anterior surface. This flap here is our left auricle, and over here is the right auricle. These auricles slightly increase each atrium's capacity so they can hold a higher volume of blood. So the auricles lay on top of the left and right atriums. So underneath our left auricle, we have our left atrium, and our right atrium would be over here. This is where the blood comes into the heart. Below the atriums lie the ventricles. We would have our left ventricle down here and the right ventricle over here. These lower chambers then force blood into either the aorta or pulmonary arteries. At the top here, we can see the aorta right there, which is a large artery that carries blood to the systemic circuit. Right next to the aorta is our brachiocephalic trunk, which now the probe is going through. This artery branches off the aorta, which gives off vessels that supply the right side of the head and right upper extremity. Remember, an artery is a blood vessel that carries blood away from the heart, while veins return blood to the heart. And at the bottom of the heart is the apex. So this is made up of the tip of the left ventricle. Across the body of the heart, we have this diagonal line, which is the intraventricular septum. And this is what separates the left and right ventricle. You can also see stemming off that here, some of these grooves are coronary arteries. So these arteries actually lead from the aorta and supply blood to the heart muscle. Next, we're gonna go inside of the heart here. So internally, we do have a better view of the chambers. So once again, we're gonna have our left atrium and our left ventricle, and then our right atrium, which is underneath the right auricle, that leads into the right ventricle, if you open that up there. Internally, I would like to talk about the bicuspid valve, and this valve is located between the left atrium and the left ventricle here. This valve prevents backflow of blood from the ventricle back to the atrium. There is another valve between the right atrium, which again is over here, and the right ventricle, and this is called the tricuspid valve, and this has the same function as the bicuspid. Now, these valves are controlled by structures called the papillary muscles, which you can see here, and they have these strings extending from them. So the strings are referred to as chordae tendineae. So the muscles pull on the strings to then open the valves. Lastly, I want to talk about the superior vena cava. This is a large vein that returns blood from the upper portions of the body back to the right atrium, as we can see there. We also have the inferior vena cava, which connects to the superior, but the inferior returns blood from the lower portions of the body back to the right atrium.